Veronica Brady. I am a nurse practitioner as well as a PhD prepared nurse researcher, and I currently work in the area of endocrinology at MD Anderson Cancer Center. Today, I had the pleasure of talking with my colleagues about endocrine toxicities related to oncology agents. And part of my talk was to really help my colleagues understand that there are a variety of drugs that are associated with endocrine toxicities. So letting them know that the endocrine glands, the adrenal gland, the pituitary, the thyroid, and the pancreas are all susceptible to these drugs. So we talked about what we most commonly see, the drugs that are most commonly implicated. And the thing that I want my colleagues to know is that glucocorticoids, of course, because they cause hyperglycemia, and then mTOR inhibitors and TKIs also cause hyperglycemia. But the immune checkpoint inhibitors can affect all of those endocrine organs. And one of the things for us to think about is that people who develop a toxicity, 43% of those folks have been shown to have a toxicity involving another organ. So it behooves us to be really kind of hypervigilant in regards to our patient population. The thing that I really wanted them to take away is that one, as nurse practitioners, PAs, we all need to be kind of hyper vigilant. We need to do good health assessments for our patients. We do need to have some baseline lab work that we do for folks before we start them on these agents and continue to monitor them throughout. So that was primarily the gist of what I talked about in about 50 minutes. It was a good conversation, and we had a number of questions in regards to how to manage hyperglycemia, what drugs to use, talk about GLP-1s. So there were a lot of great questions that came forth, but it's an interesting topic for me because it's work that is not done a lot in this space. So for nurse practitioners to be really aware that we do need to be on the lookout for these endocrine toxicities, and we also need to manage them well for the benefit of our patients. We talked about things in terms of the then and the now and the next. And so when I talked about the glucocorticoids, the TKIs, and the mTOR inhibitors, those were our thens. Our nows, the things that we are seeing are in regards to certainly the immune checkpoint inhibitors, but also the PI3Ks, because we are seeing a lot of hyperglycemia with those. And then some of the later drugs coming onto the market now, those drugs, we're really starting to see some diabetic ketoacidosis. We are seeing really profound hyperglycemia. So those are things that we're kind of keeping our eyes on the horizon. And certainly when there are combinations of those CTLA-4s and PD-1s, PD-L1s, we are seeing more side effects with those drugs, the combination drugs. My first advice would be similar to what I gave during the talk. Somebody asked me, are there any guidelines, anything to help us? And I told them the ONS guideline book has an entire chapter on endocrinopathies. And I think that that's kind of a place to start, because if we don't have those things kind of in our peripheral vision, we may miss them sometimes to the detriment of our patients. So being kind of aware of the drugs and the potential endocrinopathies, it doesn't happen to everybody, but it happens to enough folks that we do need to kind of be a little bit more vigilant. In the past when I first started, we just worried about, their blood sugar goes up, okay, we treat it, it'll come down, it'll be fine. But now we have to be concerned about, are we affecting their adrenal glands? Are we affecting their pituitary, their thyroid? So we really do need to kind of hone in and be aware, do a good baseline assessment so that as they get the drugs, is there something that changed? And also educating our patients. If you feel this, or if, these are some of the potential things that we need to be on the lookout for. Not to scare them, but to just kind of have them be aware.